Hi, everyone. Welcome to the Plan C SMA 101 training. My name is Imani, and I am the Partnerships and Engagement Manager at Plan C. So really, I'm just in charge of working with others, working with communities to spread awareness about medication abortion in fun ways and unique ways and traditional ways like this. And so I'm really excited to be here with you all. And just so I can get to know a little bit about y'all, if we could do like a brief intro, maybe in the chat, if you don't want to say it out loud, just with your name, your pronouns, if you choose, where you're coming from, and if you were a vending machine, what things would you dispense?
Hi, I am Jean Heltz. I'm from Cumberland, Maryland. I have been a longstanding advocate of choice and am very frightened of the current environment. I suppose the first thing I'd dispense would be Plan B.
Yeah, that's a really good one. And I see that Rachel in the chat said Kit Kats. And I'm also seeing Lisa from Birmingham. I'm seeing Monica wants to dispense iced coffee. I'm seeing Skip. Okay, everybody's going at the same time now, but seltzer, Skittles, lots of good stuff. I feel like that's always a fun question to ask because like it's so out the box a little and you get so many interesting answers. Fresh squeezed lemonade, chocolate chip cookies, great stuff, all essentials. Twizzlers, yes. I used to have a really big thing for Twizzlers. So I just wanted to kind of see where everybody was coming from and just get to know you all just a little bit. So what we're going to be talking about today is Abortion Pills 101 and the Plan C Guide to Pills. We're going to discuss finding abortion pills. We're going to go over how to navigate them in your state. We're going to talk about how to support a friend. We're going to talk about some resources, and we're going to talk about how to spread the word. So just to start off, the Plan C vision is really just that we envision a world in which the ability to end an early pregnancy is in the hands of the person who wants it. And we have a really cute little graphic, and I think that's just a little cute. So a little bit about Plan C. Plan C is a nonprofit information campaign dedicated to increasing awareness of and access to medication abortion. Plan C is the only organization to publish a state-by-state directory of at-home abortion options with mailed pills. And so we're also a catalyst for new routes of access to medication abortion. So we're always working to try to see if there are more providers that we can add to the guide or just new ways of getting pills to people. And lastly, we are dedicated to breaking down existing barriers to abortion pill access. So whether that's misinformation or political roadblocks, we really just want to ensure that everyone who needs this incredibly safe method is able to get it. And with Roe v. Wade in a perilous situation, this is kind of important now more than ever with how limited options are getting. And so it's really important to have a place where you can go and quickly see what your options are. And so the Plan C Guide to Pills, which we'll talk about a little bit later, is the directory that we're most known for. And so what it does is it gives you options for mailed pills, either with clinician support or telemedicine clinician support, more oh my gosh, I don't know why I can't remember that word right now, but more particularly, there we go, telemedicine, and then without clinician support, entirely online. But it also has things like hotlines and legal support and FAQs about what to expect, how to prepare, and creative options for accessing pills. So things like mail forwarding, which is essentially when you rent a mailbox in a state without restrictive abortion laws and then forward the pills to you in another state. So there are a lot of options out there, and the guide to pills just kind of collates all of that information. And so now I just want to kind of go into what medication abortion is, and then kind of go into what the guide is more specifically. And to do that, I'm going to start off with a little quiz. It's a fun quiz, I promise. It's just a collation of just kind of common questions that we get asked about medication abortion or self-managed abortion. And it's just a fun way to kind of see what you already know and a teaser into what we're going to be talking about later. And so you can feel free to drop your answers in the chat and we'll kind of discuss the right answers together. Okay, so the first question is, how long has medication abortion been approved in the US? Okay, I'm seeing less than 10, 30 plus, 10. Okay, so 20 plus. Okay, so we're getting a couple of different options. So the correct answer is 20 plus years. So the medication abortion regimen that is most commonly used in the US today was FDA approved in the year 2000. So since it's 2022, it's been about 22 years since it's been approved in the US. However, it has been approved in Europe for about 30 years and been used globally, most likely way longer than that. And so it is a little bit newer to the US, but it has been around for quite some time for people to not really know that it exists. And so the next question is, how far into a pregnancy can medication abortion pills be used according to the FDA? Yes, everybody seems to really agree about the 10 weeks, and that is true. So it is FDA approved up to 10 weeks, but a lot of research has been coming out that supports using it up to 11 weeks. And actually, the World Health Organization just put out guidelines supporting using the same protocol for up to 12 weeks. And so now it's kind of the consensus that the regimen is actually safe up to 12 weeks. And so if you were looking to get pills, you might see some kind of discrepancies in how far into a pregnancy people will describe it. And it's just because there are differing guidelines out there, essentially. So it really could be prescribed anywhere from 10 to 12, up to 10 to 12 weeks. Okay, true or false, abortion pills are safer than many over-the-counter medications. Yeah, I'm seeing a lot of truths. Okay, I couldn't even trip y'all up on that one. Yeah, so the answer is true. It is safer than a lot of over-the-counter medications. The complication rate of medication abortion is really less than 1%. It's super safe, it's super effective, and it has lower complication rates than a lot of over-the-counter medications that we see. And also, it is a lot safer than not necessarily over-the-counter medications, but a group of commonly prescribed medications. So things like Viagra, which technically require a prescription, even though it's probably really easy to get it without a prescription. But it's like immensely safer than Viagra, and that is so commonly available. And so that's just something to also kind of frame this conversation today. Okay, so the next question is, abortion pills are a combination of what two medications? So for this one, you're gonna wanna drop two answers in the chat and you can use their little shortened acronyms. Okay, I'm seeing Miffy and Miso, Miffy and Metha, Miffy and Miso. Yeah, so definitely some good answers in the chat. And the correct answer is mifepristone and misoprostol. So one thing about methotrexate is that it actually was used as an abortifacient before. However, it has a lot more negative side effects. It's a lot harsher on the body than the mifepristone misoprostol regimen. And so it's no longer used. Well, it is still used, but it's not used as much today. And so the most common regimen is the mifepristone misoprostol. And I see somebody said that I do love marzipan though. Yeah, we threw that one in there for fun. I think it's like a baking thing that people use. So yeah. There we go. Almond paste. I didn't even know that. Thanks for teaching me. Okay, so next question. In Europe and Canada, 90% of abortions are with pills. What percent of abortions in the US are medication abortions? I'm saying 54, 26, 5. So there's definitely a lot of discrepancy in this one. Okay, and so the correct answer is 54%. So really interesting about this. 2020 was the first year that the majority of US abortions were done using pills. So before 2020, the number was around 40%. But once the pandemic hit and kind of laws and restrictions around how people could prescribe medication abortion lifted and kind of shifted a bit, we started seeing this shift and that more people started to order abortion pills and utilize those instead. So for the first time ever, they were the majority of US abortions. So that's really exciting that more people are starting to learn about this option and have more access to it. And clearly there's still a lot of work to be done and a lot of challenges ahead as well. But just to know that people are starting to know more about this option is exciting. And so I think this is the last question, which is a little bit of a spicy one, and that's true or false. People in every state can access abortion pills by mail. Yeah, so I'm seeing a lot of false. I'm seeing a couple of trepidatious trues. And yeah, so the answer is true. And there are some caveats that we're going to talk about a little bit later in the presentation. But essentially, that's what the guide is for, is to show people how you can access abortion pills by mail, even if you are in restricted places. And so we're going to definitely cover that a little bit later. But just as a brief recap, medication abortion has been approved in the US for more than 20 years, and a combination of politics and stigma and misinformation has really made it so that people don't even know that it's an option. And while that's slowly changing, we definitely want to make sure that people are aware of it and that they know that it's an option, even if it's not the right option for them. But just making sure that you have the option to even factor into your decision making. So now I just want to kind of go over abortion pills and the regimen and what that looks like. So abortion with pills, which is also called medication abortion, is a modern option for ending an early pregnancy safely and effectively. The pills are a combination of two medications, mifepristone and misoprostol, or misoprostol alone if mifepristone is not available. So these medications stop a pregnancy from growing and cause cramping and bleeding to empty the uterus in a manner that's similar to a miscarriage. And so the method one, which is the most commonly used method, is mifepristone and misoprostol together. And so this method involves taking a mifepristone pill first, followed by misoprostol pills 24 to 48 hours later. And this method is about 95 to 98% effective, definitely closer to 98% at ending an early pregnancy. And this is the type of abortion with pills that is provided by clinics like Planned Parenthood or your primary care provider. So the second option is misoprostol only. And so abortion with pills can be done using only misoprostol pills. And it was previously thought that this was less effective. And so we should update this on the slide, but very recently, like a month ago, and it came out that it actually probably isn't less effective. And there was research reporting that it was around 98% effective. And so really, we're seeing that both methods are very effective and safe, but the misoprostol only method does tend to have more GI side effects. So like upset stomach, like throwing up, like those types of side effects, because it is a little bit of a harsher process in the mifepristone and misoprostol combination, but both are safe and effective and both can be used effectively. And so when I'm thinking about how safe medication abortion is, it's much safer than childbirth. The risk of death from childbirth is approximately 14 times higher than that associated with medication abortion. And so it's also the morbidity associated with childbirth exceeds that with abortion as well. So those are just like leftover complications. So whether that be something like if you had gestational diabetes or like preeclampsia, something that you didn't necessarily causes a death, but it could be like a leftover effect from the childbirth process. And going off of that, the risk of major complications, so something that would require hospitalization or surgery, is less than 0.25%. So very, very safe. The risk of complication is very low. And if you do need to be hospitalized, the treatment process for like a medication abortion gone wrong is very similar to that of a miscarriage. And in a lot of cases, you don't even necessarily need to tell a provider that you did try to self-manage abortion or used abortion pills, because they don't really show up on blood tests. So there's no real test to say that you took them. And the way that you would treat it is the same way that you would treat a like natural miscarriage, if you will. So it's a very safe procedure, and it has very clear treatments if things do go wrong as well, even though it's very rare, which I want to emphasize. So to recap, mifepristone and misoprostol have been around for over 30 years globally and are endorsed by the World Health Organization as an essential medicine. They are used by millions worldwide and are available in hundreds of countries, oftentimes over the counter. And so just to give an example, in India today, over 70% of all abortions are done at home with pills obtained without a prescription. They just got from like a chemist or pharmacist or an informal vendor. And so given the size of India, that would mean that around 13 million people a year are safely self-managing their abortions. And so it's being done safely around the world. And so this is just something we like to emphasize, because in the US, even though we know that it's safe and effective and people have been safely self-managing abortions with pills at their home for a really long time, abortion pills in the US have been kept out of reach of many due to overregulation and over-medicalization. And so the FDA restrictions have really been making it harder for physicians and other providers to be able to allow people to have access to this. Before 2020 or like 2019, before that the pandemic began, there used to be a federally mandated in-person dispensing requirement, which meant that you had to go see a physician to be prescribed this medication. That was temporarily lifted during the beginning of the pandemic, and the FDA recently just dropped it completely. And so there are not going to be reinstating that. However, individual states kind of make their own rules in regards to that. But federally speaking, the in-person dispensing requirement was dropped. But there are still a lot of other unnecessary restrictions that have been put on the prescribing medication abortion. And so they have essentially said that you can't sell it in pharmacies. They're cutting off a lot of distribution channels. And so as a result, providers have been kind of slow in adopting the pills. So in contrast to Europe, where that 90% of abortion is done with abortion pills, only about 54% of abortions in the US are, and it really is a mix of factors. But regardless, as a result, people have had to use creative means to get the pills, especially in restricted states. And one of the most common methods is purchasing them off the internet. And so this brings us to the question of what is available in states where telemedicine is restricted. So we know that in over half the states, telehealth services are active and running smoothly and working well. But in the other half of states, lawmakers have explicitly chosen to ban telehealth abortion services, often requiring patients to have things like ultrasounds or physical exams, or specifying that the patient needs to be in the physical presence of a physician, even though that's been lifted from the FDA requirements. So these restrictions create medically unnecessary barriers to access. But there are international doctors and pharmacists that are making it possible for pregnant people everywhere to get the medication they need via safe and reliable telehealth services, regardless of the availability of those telehealth services in the pregnant person's home state. And so really that is what we're seeing people do in places where the access is restricted by state laws. And so getting medications from international sources is nothing new. People do that all the time with a lot of other medications. And people have kind of started using that for abortion pills, because when you are an international provider, you kind of follow the rules of your own country versus the country that I guess the person is ordering from, if you will. And since those laws don't necessarily say anything about it being illegal to ship pills to people outside of the country, then they have no qualms with it, and it doesn't break any laws in their home country, so they're happy to do it. And so there are a lot of online pharmacies and providers who are really dedicated to getting people in the US, and specifically in these restricted states, access to abortion pills by mail. And so I wanted to take a second to just kind of mention how abortion pills by mail specifically can promote reproductive justice, because I think it's just an important thing to mention, just to put it in a larger context of the kind of bigger abortion and reproductive choice decision-making movements. And so one thing about abortion pills by mail is that they allow you to access abortion care from the comfort of your home. And that can be really big for some people and specific groups, specifically those who have a history of medical abuse and mistreatment. Being able to kind of take that healthcare into your own hands and to be able to do it at home in a space you feel comfortable, and you could surround yourself by people you feel comfortable with. And that can be a very empowering and useful practice for some people. This way of accessing reproductive health care is also very rooted in the right to self-determination. So when you're saying that you can go online and order pills and self-manage your abortion at home without ever having to consult a doctor, that's really saying that you trust pregnant people to be able to make decisions about their bodies and their health care for themselves. And you're saying that they are competent enough to do that, that this is something that they can really have control over. And that is a really big thing that not everybody gets to experience all the time. And that a lot of people really don't get to experience, especially in traditional medical systems. And so that's just another reason that abortion pills by mail can kind of promote reproductive justice or be a tool for reproductive justice. And lastly, there is minimal healthcare bureaucracy And the sliding scale model of payment can make access easier for pregnant people of color who have low incomes. So we're going to talk a little bit later about cost and things like that, but abortion pills by mail tend to run a little bit cheaper than in-clinic abortions. And there are a lot of providers that are coming up with sliding scale options or payment assistant options to kind of help eliminate some of the cost of getting pills in the mail. And that's really important because while a lot of places don't offer insurance, and that's true for both in-clinic and medication abortions, there are a lot of restrictions around abortion procedures depending on what your insurance is and where you're located. This method can kind of help cut through some of that red tape and get people the care that they need. So now we're going to kind of go into finding abortion pills. And so we're going to talk a little bit more about the guide and kind of go through it, and we'll do an activity as well. And feel free, if anybody has any questions, definitely feel free to stop me along the way or drop them in the chat so that I'm not like skipping over something that you want more information about. Okay. So the Plan C Guide to Pills, as I mentioned a little bit earlier, is a state-by-state guide to at-home abortion options, either with clinician support, completely self-managed, and then it also gives options for creative ways to access pills, and also in-clinic options as well, if you are interested. So the guide can be found at plancpills.org or specifically plancpills.org/guide. Oh, thank you for putting that in the chat. And I want to kind of walk through what it would look like if you were to kind of use the guide. And so I'm going to use New Mexico as an example, just because it is a place where telemedicine is still legal right now. And so if you're looking at the guide and you put in New Mexico, you'll kind of see the 4 categories at the bottom. So those at-home options with clinician support, self-managed at-home options, local clinics and primary care providers, and creative ways to access pills. If you're looking at the guide on your screen, it's going to look a little bit different now because this is an older screenshot of the guide, and we updated it to look a little prettier recently. And so one thing I want to mention, so if you look at some of the different options, and this is going to be looking at clinician supported methods, if you were to click on that tab, then you see that the options kind of come up and they have a couple of different identifying information along with it. And so it has delivery time, the ages that they serve, and then it also shows like what it includes in the pill, like in the packaging and things like that, as well as any details you might need to know about it. So how far up they prescribe, if they offer financial assistance, if they offer things like advanced provision, which I'll talk about later. But one thing I want to mention is the kind of legal view of things, because one big question that people tend to have is, can I get in trouble for doing this? And so we want people to know and understand the risks that may be involved in any of the choices that they make. And so when we say that there might be a potential legal risk for accessing a particular option, we'll put a little caution sign at the bottom. So if you look at that, like number 3, that aid access option, and you go all the way to like the bottom of that right-hand side, you'll see that little like yellow caution triangle sign that says learn about the potential legal risk of using this service. And so there have been 24 prosecutions since 2000 around self-managed abortion, and there's been over 100,000 self-managed abortions done. And so while that's a small number of people over a long period of time, anytime it's more than one, it definitely is too many. We definitely don't want people to be criminalized for managing their own care, but we also know that people can be criminalized even if things are perfectly legal, and that does happen, and that burden specifically falls even more intensely on communities of color and low-income communities. And so we definitely want people to know that all they need to know about an option, and to give them resources to make the best decision for themselves. And so when you click on that learn more about the legal risk, it'll take you to a page that will describe why there might be a potential legal risk. And then it will also give referrals for legal aid. And so we tend to link to the If When How Repro Legal Helpline, which is a completely free lawyering helpline that can match you with a legal professional to walk through potential risk and how to protect yourself, so that you can really feel safe and secure in making your choice. And so online pharmacy access is what you would kind of see if you were to look at getting pills without clinician support. And so there are a lot of different online pharmacies, and a lot of them are located in India, and they ship generic pills, which are usually packaged in these like little combi packs that you kind of see in the picture. So where there's one mifepristone and then those 4 misoprostol tablets. And so pricing can be as low as $150 with pills arriving in around 2 weeks. And they can also go up depending on how quickly you need them to be there. So when you see things like number 4, so the buy MTP kits, and that's $300, but it comes in 6 days. And they kind of go up from there the quicker that you need them. And so one of the questions we hear a lot about online pharmacies is, are they safe? Are they real? And do they ship the real product? And so we did do a test order of all the pills from the sites that we have listed on the guide, where we ordered from them to see, okay, how much are they? How quickly do they come? What ages do they serve? Like all the things that you would need to know about the option. And then we also had them tested to make sure that they are the medications that they say they are and the appropriate quantities. And so we do regularly test order from the sites to make sure that things are still coming, the information about delivery and pricing is still accurate. And so we really do feel like the guide is a really great place to go for kind of updated information about options in a state. And so another thing that has been coming up recently in this discussion is advance provision. And so advance provision is essentially the practice of prescribing a medication before it's needed. So it's done with a lot of medications as well, but recently providers have been opening it up to abortion pills. And so essentially it's saying that even if you're not pregnant, you can order abortion pills to keep in a medicine cabinet, just in case you might need them in the future. And so aid access is one of the main people that is providing the service, especially to people in restricted states. And it's a really great option if people are just wanting to have something on hand just to feel safe and secure in that, or if they want to, if your state has like a 6-week law and you really, really, really want to make sure that you're not breaking that, you can have that on hand just in case you might want to take them if you suspect that you might be pregnant. And so really the options are there, and advanced provision is a really great option for people who want to go that route as well. And the really great thing about aid access is that they offer a sliding scale, and they are an international human rights-based organization that specifically is created to get pills to people in restricted states. And their sliding scale goes all the way down to 0. So if you are in need of abortion pills, they definitely don't want price to ever be a barrier to access. And so if you go on their site and you order pills, and they'll have all the information about how their sliding scale works, and they really will work with you to kind of make sure that you are getting the care that you need, and that's affordable as well. And so there are other providers as well that offer sliding scales or some sort of financial assistance programs, and that will be listed next to the option on the guide if you click on a particular option. And medication abortion pills in the US, I mentioned this a little bit earlier, but they can range in price depending on the source that you're getting it from, insurance, if they take insurance, how much insurance will cover. But on average, a typical in-clinic abortion costs around $600. And abortion pills, as you can see, can really range in price. And so in places like India, where it's commonly manufactured and you can buy it over the counter, it's like $7. And while that is not, we don't have $7 prices here, there are a lot of places that are really working to try to get costs down as much as possible. So places like Aid Access that do offer that sliding scale, but most of the time it costs around $105 to $150 depending on where you are. And it takes around 14 to 21 days to ship. And that is a long time. And so the places who offer shorter ship times, so like that last one, Online Abortion Pill RX, which tend to cost like $470. When you need the pill sooner and you're going with an online pharmacy who isn't necessarily in it for the human rights of it all, they're really in it to make a profit, then they kind of will raise those prices to make sure they're getting a profit. And also because it costs a lot to ship things quickly internationally. But one thing that I want to really emphasize is that the differences in price does not equate to a difference in quality. And so a lot of people ask us about like where the best place to get the pills are from. And they think like if a place is more expensive, then it means that the pills are going to be more effective. And that's not the case. So no matter where you get the pills from, they're going to be as effective. Really, that difference in price comes down to where that pill manufacturer is located, how far it has to come, and how quickly you need it by. Okay, so now I want to do a little activity with you all if you are up for it. And what this activity is just how to navigate your state. And so we're going to go to the guide, which let me see if I can drop the link in the chat. We're going to just see what the options look like. Oh, actually the link is already in the chat. So click on the link that's already in the chat and head over to the guide. And what I want to see is if where you are, you can get abortion pills online in 14 to 21 days. And if you can, where would they be from and how much would it cost? And so feel free to use whatever state you're sitting in, or you can pick a completely new state depending on what you are most interested in looking at. And you can feel free to, you can feel free to drop it in the chat or you can say it out loud as well. And I'm seeing 110 from Aid Access. Do you know what state that's for? Virginia. Okay, yeah. So that is pretty common. If you're in a state that's restricted, Aid Access is going to be one of the more common options. And I'm seeing for midwifery, which for midwifery, just a shout out, the owner and main provider for midwifery is on our team at Plan C. So that's a really great option as well. And the price is $150 and it's going to cost 2 to 3 days to deliver. I'm seeing 105 through Aid Access in Alabama. And I'm in Maryland, you can get them from Metro. Okay, yeah, so there's a lot of options. Secure abortion pills for $200 in Idaho. Yeah, so as you can see, there are actually, for most places, there are actually a lot of options, even if you are in a restricted place. And kind of going off of that, while you're there, can you see if you can find them online in 4 days and how much that would cost? $150 from Aid Access from Michigan. Okay, yeah. And one thing I want to know about Aid Access and blue and our non-restricted states is that delivery time will depend. So the way that Aid Access works is if they are made specifically to give people in restricted states abortion pills, but there are a lot of people who come to Aid Access regardless of where they are. And so what they do is if you are in a state that allows telemedicine abortion, Aid Access has partners in those states, and they'll kind of like redirect your order through those people. So the pricing may be a little bit different, and the ship time will be a lot shorter because it's not actually coming from overseas. It's coming from a local provider in that state. You just went through Aid Access to get there. So that's just one thing about Aid Access. If you're looking at it in different states and you're like, why are the prices and ship times so different? That's why. But I also see that you can get abortion pills in 4 days for $470 on online abortion pills. So yeah, so as you can see, there's a lot of different options in a lot of places. And I just like to do that activity to kind of see there are sometimes a lot more options than you would think there might be. And also just to kind of get a feel for how the guide works and just to get a feel for it. And so now I want to talk a little bit about managing your risks. So because there are a lot of questions that people ask about legal risk and just managing your risks online when purchasing abortion pills, things that we tend to tell people are, one, to order directly from Aid Access or Las Libras or an online pharmacy. And the guide is a really great place to make sure you're getting to that actual main website. So there are some concerns about maybe people trying to create fake online pharmacies, but because we do test order from these places pretty regularly, we feel confident that the places on our sites are definitely not fake pharmacies and will get you the medications that you need. If you don't want to use the guide, you can also ask for a referral from your local doula or reproductive justice organization. You can set up a virtual mailbox in a state where telemedicine is legal. And after the pills are delivered there, they'll be forwarded to you. That's the mail forwarding option. And that is also explained in more detail on our website. And then the last option is to drive or fly to a neighboring state where telemedicine is legal. While this option is definitely not going to be a feasible option for a lot of people, it is an option. And so we want to make sure that we are highlighting that as well. Abortion isn't going to cease to be legal in every state across the US. And so if it really makes you the most comfortable and you have the resources to drive or fly to a neighboring state for care, that is definitely still an option. And so while there is no yes or no answer to whether someone may be criminalized for self-managing their abortion, we know that some people have been arrested and prosecuted, even in states where there is no law against self-managed abortion. And so it's really hard to kind of say whether or not this is going to be a completely safe legal option. However, there are people who are very much so willing to help you minimize your risk and work with you to make sure that you are protecting yourself as much as possible. And that's why we highlight the Repro Legal Helpline for any specific legal questions, because they are such an amazing resource and they are specifically designed to kind of help people work through these options. And they can also offer like free representation or care if that's what you need. And if you do end up in a situation where people are asking you questions, and while that's not common, and we don't want to scare people because it's really not that common, we just want to make sure that people have all the information and resources if they ever need them. Okay, so now I just want to touch a little bit on how to physically prepare if you or a friend is going through this procedure. And so this is really just a list of supplies to gather in advance that may be useful. And so things like heating pads, comfortable clothes, super absorbent maxi pads, blankets, ice chips, easily digestible foods, distractions, and then having a friend or abortion doula or some other support person to help. These are all really great ways to kind of make sure that you are setting yourself up for success, to be comfortable during, or as comfortable as possible during the process. There's a question. Our state may create extremely restrictive laws if Roe v. Wade is overturned. There have been concerns about online security in the future when accessing abortion. What recommendations do you have to keep personal information secure when accessing abortion pills? That is a really great question, and I'm going to save it for a second because I believe I am going to touch on a resource, or it's going to come up, I think. And if it doesn't, I will circle back around, but I will answer that question. Okay. And so in thinking of how to prepare and ways to support someone, we also want to mention just a couple of things that make it really help, that are really helpful in the process. And so validation, reflection, and distraction are what we always like to remind people of. So if you're supporting someone, just validating their feelings, talking things through with them if they want to talk through with them, if they want to talk things through, and then offering distractions, because the process can be hard emotionally or physically. And so you want to make sure that you are just asking them what they need and helping them where you can. And so offering to connect them with resources can be really helpful. And on the guide and in other places on the website, we have a lot of really great resources to help people find answers to the questions that they're looking for. And offering to keep them company and find the answers to questions they might have about the process. We also have really great resources like the miscarriage and abortion hotline linked on the guide, which is a really great place to go if you have questions about the actual medical process. That's another free medical hotline that can kind of answer any questions you might have about that. Creating a care package with the aforementioned items is really great, especially if you are really stressed, if your friend's really stressed out and they might have forgotten some things. Having that little care package can be really useful. And then just checking in. Checking in can be a really great way to just show somebody that you're there and that you're ready to help if needed. Okay. And so the abortion resources. So on our guide, we have a, here, I'm going to drop the link in the chat. On the website, we have a link to these like DIY stickers, flyers, printable resources. And one of them is the abortion resource cheat sheet. And so one of the resources that I want to highlight is the Digital Defense Fund. And this is going to your question, Monica. The Digital Defense Fund has a specific reproductive like section of it where they talk about if you are trying to get like reproductive health care or like abortion pills online, how to protect your cyber like security in that instance. And so that's the one that's the Digital Defense Fund on this sheet. And it talks about like getting VPNs or using certain browsers or how to pay using prepaid credit cards or cash or other types of things like that. So it kind of goes through very specific ways to protect your digital like presence online and going through this process. So yes, there are, I probably am not the best to explain those recommendations, but they have very clear like graphics and tutorials on how to do all of that stuff. So a really great resource to check out. Also on here, we have things like abortion doula support. So Dopo Doulas is a really great abortion doula service if somebody wants to find an abortion doula. ReproCare is a digital abortion fund. And so they kind of help to fund people who are getting abortions online. And so basically, this is just a really great sheet to have on hand if you're really quickly looking for resources and or you want to show somebody else resources. And so the last thing I kind of want to talk about is how to get involved with Plan C and other ways to spread the word. And so, I mean, y'all are already involved with Plan C. So I definitely want to thank y'all for coming to this training. And if you enjoyed it, definitely help us spread the word about Plan C and medication abortion. And there are a lot of different ways that you can do that. And so we do have an ambassadors program, which is essentially just a collective of all types of people who are just interested in spreading the word about self-managed abortion and medication abortion and increasing access. And there are communications and community organizing or creative committees that you can all sign up for. There's also social media posting. And so we have very cute social media toolkits on our website that have great graphics and pre-made captions, so you don't even have to like write a caption, which I know is like the hardest part for me. So you can definitely use those to just post and spread the information that way. And the last thing that I want to talk about is just our stickers and mini flyers. And so those are really great ways, especially for introverted people like me, to spread the word. And our mini flyers are these really cute 3x3 square business cards that have a QR code that links directly to the guide, and they're free on the website to get, and you can order between 25 and 5,000 of them. So what I tended to do was just to leave them places and just let people take them that way, because I'm not that great at like speaking to people, like cold call on the streets. But they're really cute. And a fun fact, they say I'm pregnant on them. So it's like, save this card in a place just in case one day future you or a friend needs to become unpregnant. Because when we originally launched these, we were launching them in Texas, and we were doing a mobile billboard situation. And the guy who was driving the billboard was like, absolutely not, you cannot have abortion on this truck. And we were like, okay, that's fine. So what if we say like unpregnant? And he was like, oh, okay, that's fine. And so for some reason, unpregnant was fine, but abortion was not. But we thought unpregnant was cute. And so we kept it on the cards because it's kind of just like a quirky little way of making them a little bit more accessible in different places. And then we also have the QR code stickers, which also link directly to the guide, as well as the Plan C circle stickers. So all of these things come in English and Spanish. They're all free to order on the guide or on the website. And yeah, they're free to use and they're really great. And I posted little sticker bombing parties where we just go around and post Plan C stickers places. And it's always a really fun way to kind of like get my friends together to do something like fun and also potentially helpful to people, because I have seen like on Instagram people being like, yeah, like I found this Plan C sticker, and that's really cute. And if you ever need materials ASAP, we have all of these templates that are able to be downloaded and printed wherever you are. So there are protest signs, mini flyers, there's abortion resource cheat sheets. All of those can be downloaded on the site and printed as well. And there's information on like how to do that, and in some places even where to go to do that.